Okay, we're going to go ahead and get started. So good afternoon, and thank you for joining our webinar today on what's available in my community to learn more about fall prevention. This is one of a 5-part series on active steps you can take to identify risk factors related to impaired balance and how you can prevent falls. We hope you have the opportunity to join us for several or all of these lunchtime link and learn topics during Fall Prevention Awareness Week. My name is Catherine Rotter, and I will be your moderator for today's session. We ask at this time to make sure your microphones are kept off during the presentation. You are welcome to keep your video camera on, but if you find your connection is poor, you may want to turn your video off. Both of the controls for your microphone and video are on the lower left corner of your screen. If you are calling in by phone, you will press star to both mute and unmute your phone. We will have someone on our end that may also assist with this action if you're having difficulties. As you think of questions for our presenters, use the chat button at the bottom of the screen to type in your question. We will answer all questions either live or in the chat following the presentation. You may also click on the raise your hand icon at the bottom of your screen, and we will assist with turning on your microphone to ask your question at the appropriate time. If you are calling on your phone, we will give you an opportunity to unmute and ask questions as well using the *6 function when prompted. Now, I would like to present our speakers for today's presentation. First is Tina Dawson. Since 2012, Tina launched her career with 60 and Better Incorporated, formerly known as Senior Citizen Services of Tarrant County. Currently, Tina serves as the program manager with 60 and Better. Tina is responsible for planning, managing, data collection, and promoting evidence-based programs and a master trainer in a Matter of Balance program, chronic disease self-management and diabetes self-management program, and in training lay leaders. Tina has served in various capacities with 60 and Better, including a center director, wellness facilitator, and program coordinator. Tina serves on Keep Fort Worth Beautiful as a board of director, educating and engaging the community to improve the environment, beautification, efforts, and public recognition of the Trinity River in Fort Worth and Tarrant County. Tina is an adjunct professor at Tarrant County College South Campus in Kinesiology Department. She earned her master's degree in education of kinesiology and her Bachelor of Arts and Science degree in Business Administration Interdisciplinary Studies from the Dallas Baptist University. Tina, that's a mouthful. Tina is certified in the UNT Health Science Center Geriatrics Practice Leadership Institute program. So now let me tell you a little bit about Christina Bartha. Christina is a consultant with Ardent Spirit, a consulting firm that supports nonprofit executives in fulfilling their organizational missions. Currently serving as the executive director for Texas Healthy at Home, a 501c3. Tina has extensive experience in grant management as well as program planning, implementation, and facilitation of chronic disease and diabetes self-management programs, a Matter of Balance, Aging Mastery Program, and Blue Zones Project Purpose Workshop. She is also a registered yoga teacher with the Yoga Alliance. Previously, Christina worked with 60 and Better, a 501c3, United Way of Tarrant County, an area agency of Tarrant County, Texas. Christina is a doctoral candidate pursuing her PhD in leadership and gerontology from Cornell University, Chicago, and holds a Master of Science in long-term care, senior housing, and aging services from the University of North Texas, and a Bachelor of Arts from the University of Texas at Austin. Thank you again for joining us today. I will now turn it over to our presenters.
Thank you, Catherine. Thank you for the opportunity to share 60 and Better wellness programs. 60 and Better's mission is to empower older adults to live with purpose, independence, and dignity. And we're happy to share 3 of our programs, fall prevention programs, with you today. The first one is Aging Mastery Program. Our Aging Mastery Program was created by the National Council on Aging. The Aging Mastery Program aims to help older adults to take key steps to improve their well-being, add stability to their lives, and strengthen their ties to communities. Next slide, please. Very good. Next slide. Aging Mastery Program, it's comprehensive, it's fun approach to living that celebrates the gift of longevity. We talk about the gift of time. The gift of time, central to Aging Mastery philosophy, is the belief. A belief that modest lifestyle changes can produce big results and that people can be empowered to cultivate health and longevity. Aging Mastery Program, short for AMP, encourages mastery developing sustainability behaviors across many dimensions in a core weekly curriculum. We have virtual classes that we offer, 10-week sessions, 1 day a week or 2 days a week. And this is for about 1.5 hours. We have 2 core curriculum classes that we focus in on fall prevention, which is our fall prevention session. In our fall prevention curriculum session, we talk about identifying and removing fall hazards, obstructed pathways, steps, and handrails, area rugs. We talk about lighting, toilets, and shower tubs. In our exercise and U curriculum, we talk about 4 types of physical exercise: endurance, aerobic, and or cardio, strength, balance, and flexibility. The core curriculum in Aging Mastery Program will lead to improved health, stronger financial security, enhanced well-being, and increased connectedness to communities. Next slide, please. Our next program is A Matter of Balance, an evidence-based program. The program is designed to manage falls and increase activity levels, how to reduce fall hazards in your home, how to increase your strength and balance, how to improve your overall health through increased activity. We do have virtual classes that are being piloted to see how A Matter of Balance will serve the community virtually versus face-to-face at this time. We will have more updated information in the next coming month. The program is supported by United Way of Tarrant County and its Area Agency on Aging. Next slide, please. Our last program, evidence-based program, is Walk with Ease. Walk with Ease program, it helps participants develop a walking plan that meets their particular needs, stay motivated, manage pain, and increase safety. Walk with Ease is a multi-component program that includes health education, strengthening and stretching exercises, and motivational strategies. The benefits increase physical activity, increase walking distance, speed, decrease pain, and decrease depression. Also increases balance and reduces pain, improving the mental health, flexibility, and overall physical health. Our Walk with Ease program can be done by individuals. It's a self-independent program used with a guidebook that we provide. And this is on their own or in a group. The group is led by a certified leader. Our Walk with Ease program is 6 weeks, 1 day a week, conference call. We have classes virtually as well as conference call for 1 hour. In each session, the following information is covered. health tips on how to walk safely, how to stay motivated, and setting goals for walking. And there's much more, and we have fun. Thank you. We look forward to hearing from you. Next slide, please. We invite you to contact myself, Tina Dawson, at the number that's shown at 817-413-4949, extension 217. Email address tdawson@60andbetter.org. Thank you very much, and we look forward to seeing you in our program.
Hello, everybody. So Tina's just told you about some programs that a couple of which have been up and running and some coming soon. So Bingo Size is the program I'm going to talk about, and we're very excited to bring this program to Tarrant County in early 2021, if not before. Bingo Size is a evidence-based 10-week program. It combines bingo-like game with exercise and health education. So it combines all three of these components. So those of you who have played bingo before, which is probably most, if not all of you, it's much like a regular bingo game, but the only difference is that you get to exercise off and on throughout the game, as well as be informed and educated as well about different ways to prevent falls. So this is a very fun program, and since bingo is familiar to most of us, it can be even more fun because of that. Bingo Size increases older adults' functional fitness, health knowledge, and social engagement. So you're exercising physically, and you also have that social component with the social engagement and interaction, and you are being stimulated cognitively too. So it has that component to be able to learn and be educated on topics that you may not have known about in the past, such as ways to prevent falls. So we're very excited that this program, in light of COVID-19, this program can be offered virtually. It can be offered in person in a group setting. It can also be offered in a hybrid model with a group setting while using a mobile app. It can also be offered via Zoom as well. So there are lots of different ways to participate in Bingo Size, which is very exciting since things are changing quickly, and many of us are not ready to to be in a group setting with others in person. Next slide. So what are the goals of Bingo Size? Well, first, to improve and or maintain mobility and independence. So I talked about the physical component of this program, which is throughout I got to participate in a Bingo Size demo, and it really is simply you playing bingo, and every so often you get to try an exercise, do an exercise that the trained facilitator leads you through. And you also see a picture on your screen of how to, if you're playing it virtually, you see a picture on your computer screen or your phone on how to do the exercise. So by exercising, you are increasing your mobility, and by being mobile and physically active, you're more inclined to be able to stay at home and be independent. Also, another goal is to learn and use health information focused on falls reduction and other health-related behaviors. So what this means is you're throughout the bingo size game, you, in addition to doing the exercises, you also get to learn little snippets of information that can help you to reduce falls. Like, for example, how do you arrange your home and reduce fall hazards in your home? That's just one example, but there's lots of different bits of information, simple things that you can do to decrease falls and fall risk. Another goal is to socially engage with other older adults. So for those of you who are interested in being a part of this program or even being trained as leaders in this program, this is a wonderful benefit of the program, to be able to engage with one's peers. In an in-person setting, you're actually in person and meeting new friends. If you're on a virtual version of this program, it would be somewhat like this arrangement that we have right now, but you all would be able to interact and see each other and talk to each other during the game. And you also see your facilitator, who is leading you through the bingo game and demonstrating the exercises and giving you those little snippets of educational information. But it's even virtually, we can socially engage. So I have here a YouTube video. It's very brief. It's less than 2 minutes, I believe. And Noah, if you're able to pull that up, that would be great to play now.
So kind of breaking through, I've pulled the video up. Is it displaying on your end?
I am not seeing it.
Okay. And sorry again, is it working at this point?
I see it, but
Okay.
I don't hear the sound.
Okay. Let's see.
I believe the sound started to play. You might prompt it again.
Okay. Sorry.
So you see here a group. I'll kind of narrate as we go. You see here a group. This is an in-person class, obviously, and everybody has their bingo cards out, and there's a trained facilitator leading the classes, kind of walking around, making sure everybody is has everything that they need. People doing the older adults doing exercises as they're participating in the game. And this is something different. I don't think this is bingo size anymore. There it is. So they're using the equipment, and then giving some educational tips throughout the game. So if you all have participated in evidence-based programs in the past, this is a similar setup to those programs. It's a small group setting. And then you see the mobile app there. That's exactly what it looks like. It looked like an iPad, but that you can participate on any of your electronic devices. There are tools that come with and aids that come with the packet if you're delivering it from your community or facility. All right, that's the end of it. So my narration was not as good as the video narration, but you saw the idea. You kind of got a visual of what it looks like. So it's just very familiar and fun, whether it be on Zoom, via the mobile app, or actually in person. One other thing that I think is great about this, when there is the opportunity to be back in person, conducting classes, this is going to be a program that's easily done, socially distanced, even wearing masks. So that's just something to keep in mind as well. And we do look forward to rolling this out in Tarrant County early 2021. If not before. And another thing to note about this program, I don't think I mentioned that this does meet the highest level criteria for evidence-based disease prevention and health promotion programs as established by Administration on Aging. And it qualifies for Title III-D funding. It's also approved as an evidence-based obesity prevention intervention by SNAP-Ed Toolkit. So that just means it's gotten the highest approval needed to be able to deliver it and receive funding from Older Americans Act funding. That's all I have right now.
All right, well, thank you, Christina, and thank you, Tina, for your presentations today. If anybody has a question, they can put it in the little chat box, or if you'll notice on the bottom of your screen, it says reactions, and you can click on the little hand to raise your hand to ask any questions. So if anybody has questions right now, if they'd like to put in the chat box, either raise your hand, you can talk for yourself. Questions? Well, right this second, I'm not seeing anybody typing anything in the chat box or raising their hand. Tina or Christina, is there anything else that you would like to add or expand on?
Yes, I would just like to add that we do have a Walk with These classes that will begin the last Wednesday in October for 6 sessions. And so if you're interested, please feel free to call my number that was placed on the screen, as well as email, and we can sign you up for the program. Thank you.
I also had one other thing. I didn't include my contact information on a slide. So if you do want more information about Bingo Size, if you're interested in being a participant in Bingo Size, or if you represent an organization that would like to offer Bingo Size, or if you know of an organization that wants to offer it, you can feel free to email me at Christina@ardentspirit.com. So I'll spell that CHRISTINA at ARDENTSPIRIT.com. So Christina@ardentspirit.com.
Hey, does anybody have any questions or even comments if you'd like. Well, I guess y'all covered everything very, very well. Or we just have an extra smart group with us today. I do want to let you know that Brenda Wilson put in the chat box that these programs sound awesome. Anybody else? I'll give you a couple more minutes to raise your hand to put something in the chat box.
I'll just respond to Brenda's comment. Brenda, these programs are awesome. We are so excited because for a long time we've been offering a couple select programs in Tarrant County, and they have worked really well, and they've positively impacted many, many older adults. And we're so excited now to be bringing these new programs, not new programs, but new to Tarrant County, to this area, and Walk with Ease and Bingo Size. And there are other programs to come, like SAIL, but that's not something we're talking about today. But I'll just tell you that there are some great programs being offered in this area, and we're really excited about them. So all the help that you can give us and spreading the word about them, participating yourself, or having your organization host classes, either virtually or when the time comes in person. We just appreciate the collaboration.
I love the aspect that they're already getting started virtually, because I definitely, as a caregiver of my mother-in-law and then also my mother that's out of state, the social isolation that they're feeling has been immense, and those outlets I think will be really good to help them get connected with.
Absolutely, absolutely. And each of the programs do have those components that can help to just decrease the feelings of loneliness. And I know Bingo Size, Tina can speak to the programs that she presented, but Bingo Size has been proven and shown to increase social engagement.
You know, Brenda brings up a great point, and I just wonder again if you guys are open to, you know, for some of us that maybe have parents or older friends that live out of state, of allowing for them to sort of connect to some of these local programs, because obviously the virtual platform allows for that. So has that been something of a consideration or an opportunity anybody's used to maybe share with a relative that lives out of state, or do you encourage that?
I think that is a wonderful idea, and I think that's one of the opportunities that we're seeing with virtual programs. We've been discussing how we can do that, and really it just comes down to how the programs are funded and how we're going to be able to include participants from other areas. I know we're certainly talking about that across the state of Texas, like how can different counties in Texas work together to offer these programs. Now, other states, I'm not sure exactly how that would look yet. We're learning as we go, but that definitely has been a topic of discussion. I do know too that these programs, Walk with Ease is Arthritis Foundation. So all of these programs that we've talked about today are offered nationally. So, and there are many places around the country that are offering the programs already virtually. So just as we are beginning to do here too. So there are opportunities if you want more information about that for you or for your loved one, your parent. feel free to reach out to Tina or me, and we can get you connected with the program somehow, some way. But that is a benefit and an opportunity through this virtual delivery system.
Just wanted to add to that as well. We do have telephonic classes, telephonic programs, toolkit in a box, where we reach out to the participant via conference call. And so the participant, has that opportunity to be a part of a small group in sharing program information. Very personal, and it's very rewarding, and it's been a successful program since this pandemic.
Well, I still don't see anything in the chat box or anybody's hand. I just want to still make sure everybody has that opportunity to speak if they'd like, or ask a question. Since we still have a few more minutes of time.
And just wanted to add, we do have Aging Mastery Program that is going on at Tarrant County College. So if you're interested, give us a call, and we have a class coming up in October that is in the evening. So far we have several participants that have signed up, but we do have 3 more open seats for our October 1st Aging Mastery Program.
Okay, great. Thank you, Tina.
Mm-hmm.
Christina, anything else?
I don't have anything else. We're just excited to connect with you all. Thank you for being on the call today, and thanks to my co-presenter Tina, and thanks to Catherine, and thanks to huge thanks to Kathleen Camp for putting this all together, and to Noah for helping us with the technology.
Yes, let's all give her a round of applause, and that would be on your reaction button. You can use your little clap thingy, or you can click on a thumbs up or whatever. So anyhow, well, if you guys don't have any questions or comments, I like that too.
I'm looking for this.
It's down at the bottom. Like it'll say share screen, record, reactions. So, but
Thank
you guys both so much for being with us today. And Tina and Christina, thank you again for your presentation. I would like to remind you guys and invite you to join again tomorrow. Will be the last session, and they're going to be discussing what exercise programs can I connect with to reduce falls. So this ought to be a really great session. So if you will be sure and join us again tomorrow. We appreciate you once again for being here. And if there's anything that you guys have questions on or need support on, please feel free to reach out to Tina or to Christina.
you.
I guess we're done.